I hope you're having a great day. Today I want to talk about something that we've been noticing with our patients over the last couple of months. You know, sometimes we have symptoms and we can't correlate symptoms with what's happening. And we're just told to go home, rest, take painkillers, or do different blood tests. What we've been noticing over the last couple of months, we've been seeing it for years, but over the last couple of months it's increased. Symptoms like constant headaches. Some people experience migraine-like symptoms. Sometimes you have fever, like a low-grade fever. And no one can figure what's wrong. You're going to work, you're doing your normal activities, but you have this low-grade fever. You know, you're fine, everything is good, your blood work's looking good. Sometimes you have fatigue. You're just tired all the time. You've checked your vitamin D3 levels, they're good. Your B12 levels are good. You're sleeping well, you're hydrated, but you're just tired, constantly fatigued. Sometimes you get lymph nodes that suddenly swell up, like you have a lymph node in your neck, or you have like nodes swelling up and then they disappear after 24 hours, or they come back and then they're there for a week and they disappear again. Sometimes you may have sudden body rashes which are coming and absolutely no explanation. So this is what we're learning. There is a virus in the body that can exist in us, and it can just exist very, very silently. It's called the EBV. That's the Epstein-Barr Virus. It's the EBV. It's existed for the longest time. When our immune systems, a lot of us carry it automatically, but when our immune systems fall, the EBV gets activated and it can create these symptoms. Sometimes the most severe symptoms are your liver enzymes increase, or you have an enlarged spleen. A lot of people get their scans done and they find out that their spleen is enlarged, and your doctors would tell you rest, you know, don't do anything which causes physical exertion and stuff. But yeah, sometimes you got to check for an EBV, which is an Epstein-Barr virus. You got to speak to your doctor if you have these symptoms, because they will prescribe this test for you. There are several antigen blood tests that you can do, and your doctor would be the best person to suggest which antigen test that you should do. Now, what happens if you have the EBV virus? It's a virus, so antibiotics do not work on this particular virus, but there are many, many things that you can do. EBVs are also found in children, remember that. So if your children are going through these symptoms and there's absolutely no explanation for it, ask your doctors to prescribe an EBV test, an antigen test for you. Because if you find out that your child has the EBV or you have the EBV, in adults, EBVs can be easily spread. It's also called the kissing virus, because you know, saliva can also spread it easily. When people share toothbrushes, it can spread very, very easily. So a lot of people have EBV and they don't know about it. Some people, when they get sick, like there's a lot of correlation with COVID as well. So when we got COVID, when anyone got COVID, there was a lot of inflammation in the body. This inflammation reactivated the EBV virus. So, you know, while a lot of people feel fatigued and a lot of people have still not yet recovered from getting COVID, they're still constantly tired, all their levels are in place, their lifestyle's in place, get the EBV test done, because it's good if you find out whether you have it or not. Now, like I said, there's really no medicine for EBV, but there are a lot of lifestyle changes and foods that you can eat. So since it's a virus, antiviral foods are fantastic. What are the top antiviral foods that we have? Ginger, garlic. Remember, when you're eating garlic, you got to chop it up and you got to leave it exposed to oxygen, to air, for at least 2 to 3 minutes before you eat it if you're eating it raw. Now, a lot of people don't like garlic because it's spicy, it's got a pungent kind of odor, but that's the magic in it. So some people like to cook it, some people like to steam it, that's okay. But if you're okay with raw garlic, because raw garlic is very, very powerful as an antiviral agent, this is how you do it. You take raw garlic, one piece is enough. You peel it, you wash it, and you cut it into really small, tiny bits. And then leave it exposed for 2 to 3 minutes so that the allicin gets activated with its contact with oxygen. Now, if you don't want to bite it and chew it, because you've cut it really small, you can just put it in your mouth and swallow it with water. It'll still work for you. So we have ginger, we have garlic, we have black pepper, we have turmeric, we have rosemary, dried oregano. You get these dried herbs and you get them in little bottles that you can sprinkle over your salads. You can add them to your eggs. You can add them to your curries. But all of these are very, very powerful antivirals. Stay hydrated. That's important. Exercise. Don't do too heavy a workout if you have the EBV. Walking, yoga, light weights, that's absolutely fine. Sleep. because we understand our immune systems get smarter while we sleep. So sleep is extremely important. If you're sleep deprived, EBV viruses can thrive in you, and they can also get reactivated if you've had an EBV before and now you don't have it anymore, but you're getting the symptoms. It could be reactivated. And of course, we know chronic stress levels in the human body activates everything bad within us. It suppresses our immune system, which means any virus can thrive in us. There's a lot of science showing us the correlation, and we're seeing it in our patients, between EBV and autoimmune, EBV and cancer, EBV and skin issues. So we need to understand that we're not meant to breed viruses in us. So if we have a virus, it's best that we take care of it as quickly as possible. A lot of rest is required when you have EBV fluids, warm soups, bone broths if you're non-vegetarian. All of these things are great. And of course, a diet which is normal and not rich in white sugar, white flour, because that will increase inflammation. Increase the inflammation in the human body will decrease the immune system. So yeah, like I said, a lot of people have been struggling with all of these symptoms and they just don't know what's happening. So if you have any of these symptoms, speak to your doctor, get an EBV test done. It's a test that your doctor will prescribe. There are various antigen tests that exist. Your doctor will be the best person to tell you which test to do depending on which country you live across the globe. So I hope this helps you, and remember, all the symptoms that we spoke about, if you've not figured out what's wrong with you, get yourself tested, because then you know what you have, and when you know what you have, you can treat it. Have a great day, everyone. Until next time, eat smart, move more, sleep right, breathe deep. And remember, you care is all about you.